My name is Dr Musa Mulongo. I'm a senior scientist here at ILRI. I lead the ILRI's vaccine and diagnostics work, but I also coordinate the TASC platform. We are talking about diagnostics specifically for low and middle income countries and even more specifically the livestock sector. The challenges are many. The first one is that most of the time diagnostics are just not available to farmers. And here I'm talking about diagnostics tests. Farmers are always doing diagnostics using clinical diagnosis, but then you need tests to confirm the clinical observations. And these tests are not always available. In fact, we do not have really diagnostics that farmers can buy as a rapid test or as a quick fix to trying to understand what is going on in their herds. And so that is a major problem. And so diagnostic services are generally led by the public sector. You have different satellite labs, for example, in Kenya and other places where we would say there are regional labs, and then veterinary practitioners as well as farmers take samples and take them there when there is an outbreak. And then you have that infrastructure supporting to do diagnosis. But even when you look at those veterinary satellites, those labs, they are not very well equipped. We don't always have the right capacity of people doing them. They struggle with finding the right reagents. That is another whole complicated problem that makes it difficult for them to do timely diagnostics in response to infections. And then coming up, then you think about who produces this diagnostic kit, which companies, and like I've said, there are not many, because animal health biotechnology companies do not think that in Africa they can make money from making and selling diagnostics, because they think that the demand is not up there, and because of the infrastructure challenges that we've talked about, they struggle to see the business case for doing that. We've had some cases like for CBBP, CCPP, where European companies used to produce these diagnostics, and they just stopped because the only groups which were buying were either reference labs, WOA, national ones, and which could not sustain demand.